Texas has inserted itself into the center of a sexual and reproductive health conversation once again. This time, a U.S. district judge ruled that religious employers do not need to cover HIV prevention drugs in their health plans. 150 million American workers enrolled in employer-sponsored healthcare plans stand to be impacted by the ruling, which Judge Reed O'Connor handed down on Wednesday. He sided with a group of Christian conservatives that the requirement under the Affordable Care Act to cover the prophylactic drugs violated their religious freedom, thereby violating the Constitution.
One of the plaintiffs in the case said he was against paying for a health insurance plan for his employees that covered HIV drugs because they, quote, facilitate or encourage homosexual behavior, which is contrary to the doctor's sincere religious beliefs. The ruling will most likely be appealed by the federal government. So I think we're going to have another debate on our hands on this one.
I'm surprised by that, Robby. From a libertarian perspective, why do you think that your ability to get health care, we have an employer-based health care system in this country. It's not how I would design it, but it's what we have.
Absolutely not how I would design it either.
Why should who you work for depend on determine what kind of treatment you can get?
I'm against forcing companies, employers from covering medical expenses for things they oppose morally. To be clear, I do not oppose this morally. I absolutely would include it in a health plan.
It's not morally, because that's a specific difference. The Constitution doesn't say you have a right to impose your morals on other people. It says you have a right to not be,
it's not imposing,
not to have your religious beliefs impugned. And so many people are asking, what is the religious belief that is being undermined by prescribing HIV prevention medication? Where in the Bible does it say thou shalt catch AIDS?
Again, I do not agree, from a moral religious perspective, I don't agree with this policy at all. I absolutely would, I'm not opposed to gay marriage or gay behavior or anything of the nature, but I'm allowed to have a different view for someone else. If that's your view, just as I would not force you to bake a cake for a same-sex wedding or pay for an abortion if you oppose it, I would not make you pay for it, which this is a drug that you take to prevent you from contracting HIV if you then engage in risky sexual behavior. Again, I don't have any opposition whatsoever morally to that, but I don't think you should have to cover that if you do.
So it might be news to some people, but folks other than gay folks can get HIV. Many populations are disproportionately affected, including black women, by HIV.
In fact, in Africa, gay men are not even the majority of the people who get HIV.
And right here in America, at a certain point, the fastest growing population of people contracting HIV, this was some years ago, I'm not sure if it's still the case, was in fact black women. Many people are exposed to HIV in the context of a relationship or even a marriage because their partner has cheated. And so this idea that a prophylactic drug that can be used in many different contexts by many different people is being prohibited on the basis that there is this extremely attenuated connection with a quote-unquote gay lifestyle seems to me to be obviously a stretch and really speaks to how the religious exemptions can be exploited to basically punish populations and attack basically minority groups in the exact way that I would argue the Constitution quite explicitly prohibits.
Look, I have no, again, disagreement on what you've just said. I think it doesn't make any sense. That's not, if I was an employer, I would not have that policy. I wouldn't have any of these policies.
But you could. And the courts have now,
according to the Religious Freedom Act. I think it's a straightforward application of the Religious Freedom Act, which imposes a least restrictive means. Look, employer-based health care is a really dumb system. I think we agree on that.
Medicare for all absolutely is a much more reasonable way to go.
I don't even disagree that it would be improvement over employer-based health care because we run into situations like this. The government can subsidize or just cover this drug in general. There are all sorts of other ways that don't force a private employer to cover something that they are religiously opposed to.
It does not bother you that...
No, it bothers me. I'm just saying...
Let me get the question out there, Robby. I don't know where you get your insurance. I don't know if you get it from the Hill or private insurance.
No, I get it from my other employers, Reason Magazine. No, not even true. I get it from my wife, her employment with the federal government. So there you go.
What a tangled web our insurance system is. Okay, so
I have so many employers, I can't even keep them straight at this point.
So if your wife's employer decided that they don't believe, because let's say they're Scientologists.
Right.
They don't believe in mental health drugs. If they decided that they didn't believe in penicillin because they're one of these, free-range folks that exist, they could decide based on their own religious beliefs that nobody can measure, nobody can test, nobody can prove. It's just belief that you and your family doesn't get protection.
Seems like a bad organization to work for.
It seems like a bad way to run the country.
I mean, this is a bad system, but
in the absence of any real movement, frankly, on the issue of universal health care, a single-payer healthcare system, frankly, even from the progressives in Congress who are no longer talking about this issue, much to the chagrin of many people in the Bernie movement, it seems like an enormous violation of people's rights to tell them that they cannot potentially get life-saving health care if their employer decides on a whim to target them and their community.
Philosophically, the violation of rights is imposing or forcing the person providing the thing to do something they don't want to provide.
If in the case of a cake where someone has to literally use their labor and draw designs that might not be in accordance with their own belief system, I frankly agree. I think a lot of folks, obviously, and kind of instinctively,
I'm glad to hear you say that.
who are liberal, sided with the gay couple in that cake instance. But I always had a really hard time figuring out what would happen. Like, how can you make it so that a gay couple gets to have access to a wedding cake, but not as a cake maker, I'm not forced to draw a swastika or a Confederate flag or something on a cake that I would object to.
Exactly.
And I do think that there's a difference between saying I'm not going to serve you because you're gay versus I'm not going to make a cake that says something about homosexuality or like validates it in a way that is against my beliefs. But I would argue that that is what's happening here. Constructively, these people have decided that the people who are taking PrEP are gay, and that is why they don't want to fulfill those prescriptions or pay for those prescriptions, even though that is not even true. And that's kind of like exposes the extent to which this isn't about religion in the least, because it is a drug that is taken and available to anybody to get a sexually transmitted disease, which can be caught by anybody in any context, including in the context of a religious marriage.
The justification doesn't make sense to me. I mean, I'm not even a particularly religious person, but I respect their right to hold beliefs that don't make any sense to me. And this could also be applied beyond this situation to covering gender-affirming hysterectomies, abortions, other things. And all those cases, I would say you should not be compelled to pay for something you're morally, religiously opposed to. I would extend that as broadly as possible through all of society, because I believe in voluntary associations and voluntary trade-based relationships. If you don't work for, you should work for. Again, our employer-based healthcare system is very bad, but you should. And if it is a vital government interest to provide this drug, and maybe it is. There are, according to the law, the government has to use the least restrictive means possible to achieve this end if it conflicts with the religious objection. So you could just subsidize, you could do something else. You don't have to compel someone to offer it if they're religiously opposed to it.
I think that this decision should be a rallying cry for everyone who has been arguing so vociferously over the past few years for Medicare for all. As much as there is hand-wringing about the oppressiveness of the state and how the state can dictate your behavior and become authoritarian, which is obviously something that everybody should guard for, the incredible, bigoted overreach that these courts have been facilitating, that get between individuals and their doctor and what should be one of the most private and sacred relationships that we have in this country, is really unconscionable. And the idea that the Bible, which I promise you says nothing about PrEP or HIV,
agreed.
And yet we have all of these conversations about originalism and textualism, and how, we just had in the Dobbs decision, Alito saying that you have to be able to find precedent for these kinds of rules back in time. This religious exemption, which was supposed to be about allowing individuals to be free from having the government tell them what to do, has now been weaponized as a tool to allow religious institutions to exert their religious will on their employers, which is a perverse bastardization of what the Founding Fathers individually intended.
As President Bill Clinton said when he signed this law, the Religious Freedom Act, the government should be held to a very high level of proof before it interferes with someone's free exercise of religion. We can never be too vigilant in this work.
Honestly, honestly, Robby, I've been to law school. I've taken a class on race, religion, and law. And when you look at the case law, the government frequently decides that people's religious liberties are not more important than the government interest of, I don't know, preventing HIV pandemic from spreading and all of the health implications of that. Regularly, people their heads are shaved when they join the military or when they go into prison, despite their religious beliefs. People's Social Security benefits are denied because they're Native Americans.
Why not support any of those things?
Who smoke peyote as part of their religious training. The courts are all over the place and are very happy to infringe on people's religious rights a million and one times, and it always comes down to whether or not they think one religion is a real religion or a fake religion. And I think that is exactly the kind of establishment of religion, the government picking and choosing which religions it wants to protect, and it has an interest in not upsetting. That is exactly the kind of establishment the Establishment Clause is trying to prevent.
You and I would probably agree on a lot of those cases. The Sikh Muslims having to remove their garb in schools, or carry knives. That was an issue. The peyote, of course. All of these things are things I would probably agree with you on. But like in those cases, I also see the argument for why this is a violation of someone's religious rights. But we disagree again today.
Well, another reason to continue to support and fight for Medicare for all, to actually have a freedom of choice and liberty, personal liberty issue. That's really what's at stake right now, as we have conservatives passing these rights increasingly across the country to protect the right to commune freely with your doctor. That's what's on the stake. More rising for you after this.